Welcome, thank you. It's wonderful to see an absolutely packed room. It's just amazing. And it's amazing because, not always was this way. And I have the history, and many of you here do. And it's also amazing because as I prepared to do the CEO report, which is really your report, I always reflect, and reflect also with the board and with staff, what is the theme that we should put for our AGM. So it's kind of a way of passage, it's kind of the transformation of RNAO. The first book is called Transforming Nursing Through Knowledge. Next AGM, you will hear about another book, not completed, only once in a lifetime in 1 year, but you will hear another book that is already in the works, and you will be part of it. And it's also about transformation. But it's about transformation of a professional organization. So when we thought about calling this AGM Powering Nursing to Advance Health, and some of you have read my column, it was not a mistake. It's because the word powering is very, very different than empowering. And we are way beyond empowering in this association. And I will speak about that this morning. And I will also try to explain a bit, at least, a touch, then will be a full book, theoretically, of what does it mean. What was the thinking of those of you, and I want you to stand up, please, that were in this association active in 1996 when I came to RNAO. Please stand up. And I know many of you were, so please stand up. Take pride on that because I'm speaking also to you, including to my second president, because the one that hired me was Vicky Kaminski, my second president, which they don't say in the read-up, in the nice reading that Carol does about both of us, that we both get lost. That's an attribute. But we don't get lost in where we are going, and nor do the people that stood up. So some of you have been here as long as I have been at this podium. Some of you have been here much less. Some of you, this is your first AGM. Please stand up. So the ones that were here long ago and in between will relate to some of what I'm speaking quite easily because they have seen it. They have seen it in transformation in the process. The ones that are new have a bigger job. It's not just to see it, it's to take it on and run with it. So let me start with that. The ends, actually from the first time that a president did the ends, which was Shirley Sharkey, way back, have changed, but not significantly. And that speaks well to an association, because ends are about values, and values ought not to change significantly. We ought to remain genuine, authentic to who we are, and RNAO is a perfect example of that. So no, the ends have not changed significantly. What has changed is what we do with those ends, how big we go with those ends, how we run with these ends. And when I say we, primarily it's you, and you will see that in action. So how does one power, rather than empower, 41,000 plus members? So my challenge back then, when we had only 9,000, and I said in this same podium that no one owned this association. My challenge today is quite different with my team and my boards, because you're running with this association. Yet, how did it happen that from an association that was not as active, we became such an activist association that politicians need to speak the way they spoke yesterday? And let me tell you, for those of you that were yesterday, what John Fraser said to me after, in private. He said to me, Doris, I hope you were not offended, because I just love you. And Doris, You need to know that without RNAO, and I mean it, he said, and maybe I will not be back, but I mean it, without RNAO, many of the things that you have seen in this year's happening and that I have seen would not have happened. Take notice of that, members. Take notice of that, because we are not done. So how is it that we do it? And many people are here from the international community. So this talk goes also for you, because if we can do it here, we can do it anywhere. So how did we do that? Or how do we do that? How do you power 41,000 members that are different, unique, in different sectors, in different areas, in different roles, in different interests? How do you do that? So that reminds me, Judith Shamian, who sent greetings last night, she was also president. And before she ran, she gave me a call and she said to me, Doris, I'm not so sure if to run or not. And I said, your choice. And she said, well, some people tell me, and this was many years ago, that RNAO is an elitist organization. And some others tell me that RNAO is a grassroots organization. Do you know what we are? And I said to her, we are both and more. Because we are a home for every single RN, every single NP, and every single nursing student in this province. So how do you power such a diverse organization, such a diverse membership? Well, here is the secret, which should for you not be a secret. We power it by mobilizers, by tools, many of them that are developed primarily by home office, and by a board that even back then, with Mary Ferguson-Paré, with Vanessa Burkowski, Charlotte, Rhonda, Carol, and I know Angela will fly us there, is an activist board. It's a board that wants to make a difference. Because without a board like that, I wouldn't be standing here. I would not have stayed. Those of you that know me, 6 years was my max. I would not have stayed if the sky was not the limit. So to you, boards, past, present, and future, kudos, because it's because of you and your vision and your, as Carol said to me one day, go bigger, go bigger. And actually, Angela just said that yesterday to the board, go bigger, go bigger. That's how we power. But that's how we, at the beginning, empowered. We moved from empowering to powering. We developed structures like the ENOs. How many of you start to stand up? ENOs, assembly members, members in general, interest groups, chapters like the Rainbow Nurses that one day before they existed, they called me and they said, you know, no one in the profession, no one has a space for LGBTQ community, no one. And we want to belong to RNAO. And I said, go for it, go for it. Work with Daniel Lau, prepare the papers, but it was the board again, because the board approves those interest groups that actually went for it. And yes, we were the first of any other health profession, and many still don't have the space. If you have followed the OMA debates, many still don't have a space. And we power them with a board and a staff that has your back. And no one better than Dr. Vanessa Burkowski knows that. And there are others that have spoken, Amanda Dodge, I don't know if Amanda is here, and others, whether in staff nurse positions or in senior executive positions, that they have spoken. And those that have the power, quote unquote, think that they can quiet them down. You know you cannot quiet a group of people of 41,000 plus RNs and Ps and nursing students that are not empowered, but powered. You cannot, and you should not. But we also have your back that if you speak up, and you speak up about what's good for patients, we will be there with you. You will never be alone. And I want you to know that because there is a lot of uncertainty now and in the future. You need to know that we are there on your side, at your side, all the way, if it's about what's right for patients. And we power a professional association by having the resources. I don't know if you have looked at the finances, but it should give us pause for pride. This was an association that in 1996 had barely $1 million in the bank. This is an association that is healthy today. This is an association that can have the resources that we need for you to do the work that you need to do, because you are powered to do that. This is an association that has a legal program like no other program. The PLP and LAB when you speak up. This is an association that powers you with tools, backgrounders. We don't go to all the MPPs in this province with the backgrounders. It is you. How many of you have visited in the last 10 years MPPs? Stand up, please. How many of you have visited MPPs the last 10 years? Stand up, please. This is an association that uses evidence to speak about anything we need to speak. And yes, not always we are welcome with what we want to speak about. When RNAO went out, not in a limb, because we knew where we were going, the rest didn't know. And when we go for it, we get it. So we exactly knew. When Carol and I decided that we are going to call a full public inquiry, we knew that we will get it, because no one can stop a powered organization. No one can stop a CEO and a president and a board that has 41,000 people behind, not passive people, but all active, powered members of this association. And yes, we needed to call that public inquiry because we need to understand what happened with that individual, and we also need to understand what happens every day in nursing homes. So we fixed the problem. And when we and ONA and our RNAO pushed for PTSD for nurses to be included, we also knew we will get it, and we did. So powering as members result on this. Results on 90 members visiting, 90 MPPs being visited through the year by over 200 members. 90 MPPs out of 107. And in the last 10 years, that number has never decreased. We are between 85 and 104. And with that, I have a call that Sarah Boswell, acting director for policy, said to me, do not forget to tell members. We have many MPPs that want to go to the Take Your MPP or Take Your Politician to work. Many MPPs and many candidates. We need members. So in the break, Sarah, please stand up. In the break, please go to Sarah. And we need you to take MPPs or candidates to your workplace. This is where we have been in the province at the political level this year. In every single corner. By touch every single MPP one way or another. And this is why we get the response that you saw last night, last year, the previous year, and yes, next year you will see that too. So how does it happen? Well, get used to it, because it does not happen on the way that you see on the right. It does not happen by a top-down organization that tries to control and have order, that has rules, is managed, and is rigid. It does not, and it cannot. It happens by an organization that is disruptive based on values and creates disruption to shape the system to what the system needs to be. That is people-led, many, 41,000 of you and change. That is, as you heard me for many years say, a social movement for the betterment of humankind And yes, it is the betterment of humankind when you speak about social determinants of health. And it is even more for the betterment of humankind when you speak about the environmental determinants of health. Because without an environment, there is no home. As beautiful as your home may be, if we do not have a healthy, clean environment, as Florence Nightingale said, with fresh air, clean, we don't have a home. We will all choke, whether it's you, your kids, your grandkids, and it doesn't take more than that, those generations. And we do that by being proactive and being creative. And so yes, every time there is a challenge, from the challenge, actually we become better and better and better at RNAO. Because from the challenge, there is creativity that brings solutions that we didn't even think before. And we do that in a very unique way. The reason I insist that people use the RN pin or the NP pin or the student pin is because that creates what I call social identity premier. Please. I wish I could go even back so you can see. So you can see about the transformation of RNAO. Because in many ways, Premier, you have transformed this province too. And I want to say that to you. So this collective identity, that this is our RNAO, that no one can stop us, that yes, we are disruptive when we need to be, and we are a social movement for the betterment of humankind, Ontarios and beyond, is the chapter of RNAO today. And it's the chapter that we will continue to take forward. And it will be the most interesting chapter, not only for you, but for our board and for our staff. Because it will be a chapter of disruption, but disruption when it's good for patients, good for Ontarians. It will be a chapter where many more will have a voice, and you will see how many have it today already. And here are some of the voices of this past year, and as I say your names, please stand up. Shirley Kennedy, that has transformed the care for inmates in this province. Aaron Clark and his team from mental health nurses that has transformed. Sheena Howard in primary care that lives fully with who she is, who she represents, not only in primary care, but with the LGBT community. Our colleagues in parish nursing and our colleagues in SHINEC, and in fact every single RNAO member that understands that social determinants of health matter, that understands that addictions are a disease, that understand that safe needles is a must, and that SIS is a must. Our President, Carol Teeming, that with that grace that you see, that looks majestic, is a force to reckon with, is a force to reckon with, and it lives not just in her actions, in who she is as a person, social determinants of health. And Angela Cooper, for those of us that know her from back then, you haven't seen nothing if you haven't seen Angela. And Premier, whether it's you, and if it's someone else, they better get ready for Angela, because the truck is coming. I said to my team yesterday, this year you had it good, the last 2 years you had a calm person and you have a Now, guess what you will have? And you know what? That's what we need now. So that's the right timing, as Carol was saying to me the other day. Every president in RNAO has the right timing. And these are the social enablers that have helped us to become the social movement that we are. The enablers of the ENO's network, the enablers of the technology, the enablers of the assembly that is an activist assembly, the enablers of the workplace liaisons, and so many, many more. So look at how we are doing. Presence in the social media, presence in Twitter, Facebook. Look at how many members this year, 780 of you in the media. If that's not unruly, if that's not because this organization decided by design, not by chance, that will not have only one spokesperson, president and CEO, or as in some, only even the president, but decided that all members have an important voice. Look at the result, and you tell me if it's stoppable. Because they can stop a president, maybe. They can stop a CEO, unlikely. They cannot stop, even if they want. And I say they, it's not premiers only, it's anybody. It's anybody in healthcare organizations, and I'm looking at one. They cannot stop any of you to speak truth to power if it's good for patients and good for the public, when you have 780 speaking up. So, Premier, you came at the right time, because I'm going to share some of what we asked and what we got, which is very good. So we put out the 70-year RN effectiveness database, and we had changes in scope of practice, including RN prescribing, which is moving slower than what we want, but is moving. We had a meeting with Ann Coughlin at the college yesterday at RNAO. Stay tuned, 219. 218 will bring good news. 219, I can smell the even better news. Regulatory changes to nurse practitioners on prescribing controlled substances. And yes, we have NPs included in MAID. We ask on healthy public policy and nursing. You can clap, but I will keep going. Otherwise, we will be here for many hours, so feel free to clap, because you should be excited, because we got it because of you. Every single one of those action alerts that we sent had hundreds and hundreds of responses. Again, it's important conceptually to understand. You don't create a social movement by one person speaking, even not an entire board. But when you have the number of people that speak, whether in the media or in action alerts, that's what creates it. So we got PCFA for nurse practitioners, and they can register at RNAO. And PTSD we got, yes, it is what? Independent psychotherapy, and before Minister Hoskins left, he actually sent a letter to the college on that, and RNAO had everything to do with that. We got authority for NPs for X-rays that started in April 1st, and much more to come. And we got RNs to complete the ODSP form in January 2018. On health system transformation, and you heard me speak before about that, we were the first out of the gate asking for a full public inquiry. And I had the privilege, Premier, to work with your staff directly to push those terms of reference to be as broad as they need to be. And when the media called me, I was honest in my answer. I said, kudos to you, Premier, for having the courage to look at the microscope, yes, about what I don't want to say it in the public sphere, what I think this individual is, a very sick individual. That happens the first time in my entire career, quite frankly, here in Canada. But also what happens every day in nursing homes, and that's where the courage comes. It would have easier to just keep it tight, keep it, right? But no, kudos to you for having the courage to go broader. And we got the funding. Last year, we said we got the offloading devices, first jurisdiction in North America that will cover offloading devices for persons with diabetes. This year, the funding is out the door. On that, of course, not only the political level, but Dr. Bob Bell and others have everything to do with that. And yes, RNAO is the one that pushed and pushed until it happened. And we got also the funding for MPs and RNs and RPNs to have increases in their compensation in primary care. And yes, it's not enough, and we will continue, but it's a way to start before we had nothing. And we got health system transparency, which actually RNAO also pushed for that. Social determinants of health, I spoke about the situation with inmates and the role that we have played with that, the basic income pilots that we were involved, supervised injection services, which we were involved, and the Fair Workplaces Act that is delivering better, and also the Moss Park that was open to my colleagues, Lee Chapman and my colleague from Ottawa. Kudos for going for it. I had a member that wrote to me, how is it possible that RNAO is supporting something illegal? I said, well, when policies fail, nurses save lives, and that's what we do. And of course, we got the go-ahead for the implementation of legal sites now. On social determinants, I do want to acknowledge a specific member, Kerry Pickering. If you are here, please stand up. Kerry Pickering, the president of ONEC, actually is the one that brought to our attention some of the issues that have to do with nuclear preparedness. And she's the one that participated on a press conference on it. So when I say that it's you that is today powering RNAO and powering health, it is you that is doing that. And we got much more in the area of environmental determinants. And yes, we are supporting carbon pricing. We are supporting anything that can keep a home for Ontarians, Canadians, and beyond, because without environment, we have absolutely nothing. So that is only on the policy arena. I will run very fast through the VPG program, because after all, you have a whole book to read now. Test is tomorrow. So 6 best practice guidelines this year. 6 best practice guidelines to my RNAO team, Valerie Gordiza, Heather McConnell, and Lucia. I don't know if you're here, and all the VPG team, stand up, please, and get an applause. All the VPG team, it cannot be that the VPG team is not here. And Suman and long-term care. They must be working in more VPGs then. Some of them is next editions, because they can rely on us for the VPGs. That's the beauty. We don't just produce VPGs, they can rely on us. And then some of them are new, like the supervised injection services, and that already is out, and the LGBT one that is coming out. And yes, we have publications, as you know. How am I doing with time?
Well,
10 minutes,
yeah,
and I finish?
Probably no.
Okay, we will run then.
Yeah.
Okay, we will run. On the issue of capacity building, we don't just give tools, we give capacity building to people. We tell them how to use the VPGs. And on that, of course, over 8,000 nurses participated in Ontario alone on capacity building, and many more around the world. This is how Ontario looks from the VPSO perspective, and this is how the globe looks out of VPGs, and the international and national VPSOs and provincial, please stand up and be applauded. These are the tools that they develop, and this is the technology that enables them to act. This is the evaluation that we are doing together, and these are the results that we are demonstrating. decreases in pressure ulcers, decreases in pressure injuries, decreases in falls, decrease in the use of restraints, measured, proven, and successful. And yes, that results in cost savings for the system, no doubt. And we have now moving to the stage of linking policy, evidence-based policy, and evidence-based practice guidelines. And this is how we were able to push for the CIS, and this is how we were able to push for offloading devices. The beauty is that it's not only the guidelines and the policy, it's also the tools for communications. It's also the tools from IT. So this year, we're celebrating 2 major accomplishments. One is 20 years of the Best Practice Guidelines program, and the gift for the program is the book. The second is 20 years since finally nurse practitioners were recognized through legislation, and of course, Gary Garrow is our leader on that. So it doesn't matter if it's in social determinants of health, if it's in environmental determinants of health, or if it's on evidence-based practice here at home or abroad. We make a difference globally and locally. And it is because of these 7 reasons. Location. It is definitely because it's RNAO with the richness of RNAO in all the domains of work of RNAO: policy, practice, communications, IT, membership, and also finances. And to my director, stand up and get an applause. So there is no magic in the word association. We must never forget that the individual, you, make an association. What an association is depends on its members. A nurses' association can never be a substitute for the individual nurse. It is she, and today I hope Florence Nightingale would say he and they, who must, each in her own measure, give life to the association, while the association helps her. So I want to do something with you to make sure that you got the message that you are powering RNAO. First, I want the board to stand and clap. Second, I want the premier to clap. Then I want the first row here to stand, turn around, and clap. And if you can put, please, the screens. If you can put the screens there. Then I want, then turn around, well turned, you are clapping to them. Next row, the screens. Can someone put the screen, Sarah? Then the next one, clap, and next one, next one, next one, next one, next one, all the way, clap and applaud, and the music goes on. Can you see yourself? That's you, members. That's you powering RNAO, and you powering this province, and you powering the people that we take care of. So thank you, thank you, thank you for another year of success to our RNAO. Your RNAO. Keep going fast and the higher and the more brave and courageous, as long as it's anchored on values and driven by evidence. Keep going. The sky is the limit. Thank you.